Hi, I'm Dr. Alvarez with Endobariatric.com, and today we will be talking about gastroparesis. Gastroparesis is a condition that affects the normal, spontaneous movements of the muscles, also known as motility, inside your stomach. Ordinarily, strong muscular contractions propel food through your digestive tract, but if you do have gastroparesis, your stomach's motility is slowed down or doesn't work at all, preventing your stomach from emptying properly. The cause of gastroparesis is usually unknown. Sometimes it's a direct complication of diabetes. And certain medications such as opioid pain relievers, sometimes some antidepressants, sometimes high blood pressure medication, or some allergy medications can lead to slow gastric emptying and cause very similar symptoms. For people who already have gastroparesis, these medications will make their condition or their symptoms worse. Gastroparesis can interfere with normal digestion, can cause nausea, vomiting, abdominal pain. It could also cause problems with blood sugar levels and nutrition. Some signs and symptoms of gastroparesis include vomiting, nausea, abdominal bloating, abdominal pain, a feeling of fullness after eating just a few bites, vomiting undigested food eaten a few hours earlier, acid reflux, very common, among other conditions and other symptoms. It is important to point out that many people with gastroparesis don't have any noticeable signs or symptoms. It's not always clear what leads to gastroparesis, but in some cases it can be caused by damage to a nerve that controls the stomach muscles, also known as the vagus nerve. Factors that can increase the risk of developing gastroparesis are diabetes that we mentioned already, abdominal or esophageal surgery that damaged the vagus nerve, infection, usually from a virus, certain medications that slow down the rate of the stomach, the way it empties, such as the narcotic or pain medications that we mentioned, certain conditions like connective tissue diseases like scleroderma, nervous system diseases such as Parkinson's disease or multiple sclerosis, and your thyroid, underactive thyroid condition, also known as hypothyroidism. And very important that women are more likely to develop gastroparesis than men are. The diagnosis, well, it's made using several tests to help identify gastroparesis and to rule out other conditions that may cause similar symptoms. Tests may include gastric emptying tests or upper endoscopy. Although there is no cure for gastroparesis, changes to your diet along with some medication can offer some relief. Treating gastroparesis begins with identifying and treating the underlying condition. If diabetes is the cause of the gastroparesis, your doctor can work with you to help you take control of this situation. Maintaining adequate nutrition is the most important goal in the treatment of gastroparesis. Many people can manage gastroparesis with dietary changes. Medications to treat gastroparesis may include medications that stimulate the stomach's muscles and include metoclopramide, which is Reglan, or erythromycin. Now, metoclopramide is a medication that has a very high risk of serious side effects, and erythromycin may lose its effectiveness over time and can cause some side effects such as diarrhea. There is a newer medication which is domperidone, and this has fewer side effects, although the availability is restricted. Drugs that can help ease nausea, of course, or vomiting include diphenhydramine, which is Benadryl, or ondansetron, which is Sofran. How about surgical treatment? That is where we as bariatric surgeons come in. The sleeve gastrectomy, or gastric sleeve, has been shown to help patients struggling with gastroparesis since it stimulates a rapid gastric emptying. At the same time, the sleeve gastrectomy surgery will promote weight loss and will help take control of the patient's diabetes. Always contact your doctor for more information, and I hope you find this information useful. I'm Dr. Alvarez with Endobariatric.com, where we are changing lives one sleeve at a time. Take care and God bless.